if an individual were to come to you and say, "What should I do to track my health history?" What recommendations would you make for them? Would you tell them to start a health history? Would you
Of
tell
course.
them
I
to?
mean, you start with the basics. You put down your measurements. The only way to track information and to change results is to have data. So you need to have your height, your weight, your activity level, basic studies, basic lab and urine is helpful just to get an idea. Are we dealing with a healthy state to begin with? And if not, what steps can be taken to correct that?
What ages do you think is an appropriate age to start tracking
Well,
this?
it's changing, right? I mean, right now we have diabetes developing in the grade school children. So, and that's something that was unheard of. We have a generation now that are having advanced illnesses at a rate that didn't exist before. That speculated will die before their parents, which is unheard of, and it's a true travesty. So, in grade school, you know.
How many diseases could be prevented, do you think, if you started early enough? Let's, instead of the adolescents, let's say we started even at 20.
Sure.
Just from what you've seen that have accelerated just simply because an individual has not taken that step to track their health care.
Certainly the majority of illnesses are behavioral based, and certainly the interaction that our own genetics, the environment that we place our body into, that's something we can control, and the majority of illnesses could be definitely allayed by our own behaviors.
Would an individual benefit from all of this tracking of the information, storing of the information, so much so that it could possibly prevent some of the serious things, even like cancer?
Sure. I mean, cancer is a state of irregular cell growth and uncontrolled, unchecked. It becomes an issue of chronicity, and so if you stop the process early on, those states shouldn't develop.
What would you recommend that everybody should do at least once a year? So you've got a health history.
Sure. I think it's important to have, just the basic studies, which would include a chemistry panel. And
Let's break it down. Okay, the chemistry panel. What's involved in the chemistry? Just briefly.
You look at electrolytes, which they're usually sodium chloride, potassium, and then bicarbonate, which is what our acid base is based on, and our metabolism is a part of that. Kidney function, our BUN creatinine, and then a glucose, right? I mean, that's your Chem 7.
So that's
basically.
to help keep track of where your kidneys are, keep track of where your blood
metabolism,
sugars are, your metabolism is. So that'd be the comprehensive metabolic. What would be another one that you would do?
Well, and the comprehensive would also then have some liver function studies in it as well.
Okay.
Yeah. And then a CBC, a complete blood cell count, to look to see, what your white blood cells, your hemoglobin, hematocrit, are you anemic, platelet function, and then the differential plus or minus depending on that white blood cell count. And then depending on, are you dealing with a male and at what age?
Well, let's say that it's a male. Well, if it was a male. So you've got a comprehensive metabolic.
Okay.
You've got a CBC.
Yep.
What would be 3 more that you would recommend?
I like a urinalysis. I think a UA is very helpful. It gives a lot of information. If you have, for example, spilling of glucose into your urine, that shouldn't happen. Our kidneys should not be letting large molecules through. And you would that's very telling in itself, just by urinating, right? And you can also look to see if there's red blood cells. You start to wonder, again, is that a glomerulonephritis? Is it some type of maybe a kidney stone? Is there some other thing that goes along with it? Other symptoms that can suggest? We get a lot of information, how well you're concentrating your urine, etc. The UA gives you a lot of information.
What else would you recommend for a male?
For a male, it depends upon the age of the male, but looking at their hormone levels is important, particularly in somebody over 30 years of age.
What hormones would you look for?
Testosterone, I would look for that, definitely.
Okay.
DHEA is a good one to get, a basic hormone. And again, depending on the age, a little older, you might want to get a prostatic specific antigen. A PSA, not because it tells you definitively whether or not there's an active problem, something like prostatism or even prostatic cancer, but markers are helpful. You have something to hang your hat on, and then next year you get another one. You say, "Wow, it's an elevation in it. We need to be interested in that, at least, not maybe concerned, but interested."
Should a 30-year-old start off with a PSA? I mean, so they could get a
Depends upon your family history. Is there a history of prostatic cancer or things such as that? Are you having symptoms? Are you having a decreased urine flow? There are interesting aspects that would lead to, I think at 30 it would be a good idea.
What other things? So you've got the prostate, the CBC, the urinalysis, the chem panel, the comprehensive metabolic panel. What other would you throw in there? If anything, the hormone panels, we've got the testosterone,
Sure.
etc. At least that being the basic, then that would be.
I think that's a good place. That's a really good place to start. That's a very comprehensive place to
So
start.
if you start that, and you've got a ongoing history that you keep in your own records. This is
Right.
something that you can then track.
Right.